AIDS remains one of the world's most serious health challenges. But while HIV infections and AIDS-related deaths are both falling, is the real fight now against fear, ignorance and discrimination? This is Inside Story. Hello again, I'm James Bays. Welcome to the programme. The United Nations has set a 3-point target as it marks World AIDS Day. It's outlined a vision to achieve 0 new HIV infections, 0 AIDS-related deaths, and perhaps most significantly, 0 discrimination. Campaign groups say the stigma associated with HIV and AIDS is as big a problem as the disease itself. Hospitals in China are being accused of turning away people with HIV and refusing surgery for patients who test positive for the virus. A study by the UN agency, the International Labour Organization, says healthcare workers commonly shun these sorts of patients, even for ailments unrelated to AIDS. And Nigeria's AIDS Healthcare Foundation says the stigma associated with the disease is still a major challenge in Africa's most populous nation. The group says despite increased awareness, being HIV positive is still considered a taboo, with many believing it to be a death sentence. So how successful is the global fight against AIDS? To answer this question, we're joined by our panel of experts. In Geneva, Bernard Schwarzländer, Director for Evidence, Strategy and Results at UNAIDS. In Johannesburg, Lynette Mobuti, Regional Advocacy Team Leader for the Rights Alliance for Southern Africa. And in Hong Kong, Jiewei Chen, Founding Director of the AIDS Institute at the University of Hong Kong. Welcome to all of you. Bernard, if I can start by asking you, as the UN marks World AIDS Day again, is this a time to celebrate achievement or is it a time for continuing concern?
It's both. There's no question that we have seen very great success, and particularly over the last 2 years, where we have seen an acceleration in programs with achievements that we have seen only over a decade period before. So there's more people on treatment than ever before. It's a 40% increase just over the past 2 years. We have seen significant reductions in the number of new infections. There's 25 countries where the number of new infections has come down by more than 50% over the past 10 years. So there's a lot of reason to really be optimistic. So we do know that we can actually end AIDS. However, you're right, there still is significant concern. There's still 7 million people who do not receive treatment, even though they should receive it. There's still 2.5 million new infections every year, and we have to reach all of those, and we have to make sure that these infections stop.
Lynette, your view on that, how concerned are you?
We're very concerned. I mean, I represent a regional organization of 60 plus civil society organizations working for rights-based approaches to HIV and the TB response. And stigma and discrimination remains one of the challenges that we do face. We feel that, mostly one of the leading causes of this is because we've got too many laws that criminalize people. So this is the major hindrance that is actually reversing the gains that we've made so far. We've got punitive laws in countries that criminalize same-sex relations, that criminalize sex workers, as well as HIV exposure and transmission. So this actually keeps people away from accessing essential services instead of coming forth and accessing those. As we've just previously mentioned, healthcare workers seem to be part of the problem, but stigma and discrimination is something that should be addressed, but that states should take leadership in addressing this.
Jiewei, in Hong Kong, we've seen positive headlines about HIV and AIDS in the last few years. Is there a danger that these positive headlines could create complacency?
In fact, in my personal opinion, in the past years, the situation in China has been improved dramatically. For example, in terms of the number of the professional medical services and been trained to provide the necessary service to treat AIDS patients. Just used last year as an example, the number of treated patients have been increased 50%. So the overall situation has been improved, but certainly there are still major gaps at this stage.
OK, well, it's some 30 years since the first time that AIDS was recognised. The first recognised case occurred in the US in the early 1980s. Most of these first reported victims were gay men and people who injected drugs. The discovery of HIV, human immunodeficiency virus, was made soon after. Since then, around 30 million people have died, with more than 60 million people infected. In 1998, trials of an HIV vaccine began. Until now, no cure has been found. Last year, researchers provided an HIV vaccine to monkeys. It worked on half the test subjects. Fighting the stigma associated with the infection has also shown some progress. In 2010, the United States, South Korea, China and Namibia all lifted travel bans for people living with HIV. Bernard, if I can ask you about the medical aspects of this, if you go back to the initial occurrence of AIDS back in the 1980s, major advances, yes?
There's major advances, in particular around treatment. Clearly, when I was a medical doctor, young medical doctor treating HIV, people with HIV, it was a death sentence. We didn't know everything that by that point in time yet, but clearly people had no chance to survive for a very long time once the disease developed in the body. We have treatment today. We have very effective triple therapy, which can be taken in one pill a day. It's not that expensive, particularly in countries of Africa and poor countries elsewhere. And you can live perfectly well. You can be productive. You can be in the job. You can, bring money for your family. So there's no reason why we should be afraid of dying of AIDS anymore. There's no reason why we should be afraid of living with HIV anymore, that the way we had to be like 20 years ago.
Yeah, your organisation has those goals that we brought up earlier on. We're talking about the treatment right now and zero deaths. Lynette, you heard there about the drugs that are available. I know you know all about those drugs. Are they actually available where you are in southern Africa to the people who need them most?
At current point, actually, we've got a lot of drug stockouts I represent the Southern African Development Community, so SADC. And in the 15 countries, we've got an inconsistency of supply of drugs. So you get countries like South Africa who have moved quite far in providing, free ARVs to patients who do access the public sector. But then you get countries like Mozambique or Angola where really, treatment access is something of a dream. So as much as we do treatment literacy education as the AIDS and Rights Alliance for Southern Africa, it still is very difficult for our country partners to, raise these expectations of how the drugs work when they cannot actually access them in the public sector.
Well, just explain for our viewers, Lynette, just explain for our viewers why they're not getting the treatment. Is it because the drugs aren't there? Is it because these individual countries can't afford the drugs? What's the reason?
Well, there are many reasons. A lot of it has got to do with the political will around HIV and the fact that, a lot of our governments signed the Abuja Declaration in 2001, committing to putting towards, the health sector 15% of the national budgets. This is still not happening. So you're getting a lot of multilateral organizations, as well as other global partners, such as, the Global Fund and PEPFAR, who are trying to fill these gaps. But it's still quite a national response and national ownership that is required for people to get the right access. And this is where the problem lies. The second problem as well is geographical location. So, the more urban you are, the easier you are able to access these drugs. But if you live in the rural areas, generally people have to walk like 10 kilometers to get to the nearest health facility, which really, causes a lot of problems, and people don't even bother to then go that route or even want to test, because they know that it's going to be quite a lot of work for them to get to those drugs. As well, governments are not supporting people enough with giving them the structures in order for them to access the medication. So we have a lot of problems, and we've got organizations such as Doctors Without Borders, MSF, who are trying to get drugs to the people, and their efforts have actually scaled up treatment access quite a lot, but we still face quite a big challenge in the remote areas where people aren't accessing drugs, and now in the urban areas where people now need second and third line drugs. We don't have a lot of countries in sub-Saharan Africa don't have those second and third line drugs, meaning that we're dealing with other challenges, including intellectual property challenges, for us to access those drugs.
OK, Jue in Hong Kong, I'd like an Asian perspective on this. We've heard that if you take this cocktail of drugs, it'll stop people dying from HIV. Are people getting those drugs in Asia?
Yes, actually in China in particular, actually government already have a policy called the 4 Free 1 Care. One of the free actually is free treatment for infected individuals, especially in rural areas. And the similar situation, as I just heard in Africa, also occur in China. For example, many of the infected individuals living in rather rural areas, like Yunnan province and some other provinces. But the major challenge for us actually is providing not just the drug, actually the necessary medical services. And we know the antiretroviral treatment, one of the very important issues is to improve the adherence rate, and so that the drug is properly provided and the necessary medical services are provided at the same time. So in those rural areas, with recent year progress, and we have to train a lot of local doctors able to provide such kind of medical services instead of just the drugs. And I do believe the number of the increase of the treated patients is one of the highlighted indication we are actually moving to the correct direction.
Bernard in Geneva, I'd like to ask you about diagnosis, testing people for HIV. There are many people, aren't there, in the world who don't know that they have the virus. What more needs to be done about diagnosis, and how important is it to diagnose people early?
Early diagnosis is one of the most important factors for the lack of access for treatment right now. What we see in many countries in Africa and Asia is that those who really get sick are quite likely to actually receive treatment, but very often that's too late. It's not only too late for the person, because when somebody is really sick, it's very, very difficult to regain enough strength to then fully recover. So a lot of the people who come very late to the hospitals don't have a chance to really recover fully, or they die over the next couple of months because they're simply coming in too late. Also, what we have seen is that if people start treatment earlier, not only we can avoid that they get sick, they also don't lose the jobs. There's now very good studies, especially from the southern part of Africa, that show that early treatment basically keeps health intact, keeps family intact, keeps children in school. So there's a real economic argument to start earlier. The real challenge very often is that young people in particular, they feel healthy, that they don't see reason why they should come forward to be tested. So about half of the people living with HIV do not know their status. And
so
we have
Bernard,
to work on that.
If I can ask you, what about the idea of mandatory testing? Because I know one task force in the US has suggested that everyone between the age of 15 and 65 should be tested. What's the UN's view on that?
I think we have to be very careful with the wording that we use here. The task force in the US has not recommended mandatory testing. The task force has recommended that tests be offered on a routine basis. That means whenever somebody comes to a hospital, young people or older people, that they are automatically offered an HIV test, like they be offered many other things. Then they will be routinely done, so that we really have a chance to find those people who may not know about the HIV infection yet. We are very clearly of the opinion that nobody should be tested against their will. If somebody does not want to know the HIV status, then of course we have to respect that. However, we also see very few reasons why somebody should really have that concern, and we have to make sure that we offer services in a way that people can accept them, they can trust them, and that they can benefit from the services that we can offer.
OK, Bernard, let us look a little closer at your latest UN figures that show that around 35 million people are living with HIV. That's up from 8 million in 1990. It's partly because people who are infected are living longer. Rates of HIV infection have actually been reduced by half in 25 developing countries since 2001. Sub-Saharan Africa has seen a 25% drop in new infections, but the continent remains the worst affected area, with more than 23 million people living with HIV. The Caribbean has the second highest prevalence, but new infections have also dropped there by more than 40%. In contrast, now the bad news, infections in the Middle East and North Africa have risen by more than 35% over the past decade to more than 250,000. And Eastern Europe and Central Asia have seen rises in new infections and the overall number of people with HIV and AIDS-related deaths. Staying with you, Bernard, explain to me why some parts of the world are seeing the situation improve and some parts of the world are seeing it getting much more grim.
We have seen the most significant success, as you have just described, in those areas where actually HIV infections rate are highest. That is Africa, that is the Caribbean. And I think in many ways this is a success of our prevention campaigns, of an increasing commitment that we see in governments, increasing inclusion of civil society in the fight against AIDS, and in communities who talk to people in the fight against AIDS. We are very concerned, of course, about the increasing trend, in particular in North Africa and the Middle East and in Eastern Europe. And in many ways, this is a question of choice. In these areas, we have epidemics which are concentrated in so-called high-risk, key populations where risk is especially high for HIV infection. But those are all behaviors which are at the margins of society. They're outside the norms or the societal norms, and governments in particular find it very difficult to really tackle programs here. This is especially traumatic because in some of these populations, it would be very easy to stop transmission of HIV, in particular, for example, in injecting drug users. There's no reason why an injecting drug user would not want to use a clean needle if that person has access to a clean needle. And by really providing these services at much larger scale, we could have a very, very dramatic and quick effect on the epidemics in these regions.
Well, let's see what you're saying, how it plays out on the ground. Lynette, we've heard Bernard say prevention is the key. What do you need in Southern Africa to try and increase prevention of infection of HIV?
I mean, a lot of our partner organizations on the ground in the various 15 SADC countries are doing a lot of advocacy around, stigma and discrimination, around awareness, trying to get people to test. But as the gentleman before me just mentioned, coercive testing is one of those strategies that have been employed by some governments. And mandatory testing really does not help. This is why we try to push for human rights-based approaches where the person is seen and not just the clinical approach is seen. We need people to understand the effects of why they should test. We need people to be explained, and we need people to actually get a lot of support after they've been tested. Currently, people are sometimes being coercively tested, which, as you can imagine, really scares a person who, first of all, self-stigmatizes themselves, and then secondly, is stigmatized by a community. We need such approaches that government does actually start funding more stigma-related, stigma prevention strategies in the national strategies towards HIV/AIDS. This will see a reduction of the transmission rates, because then people will actually want to access the public health system and want to freely come test. At current point, what is happening, where you have in Swaziland, for instance, the test and treat type model, you're getting a lot more stigma and a lot more people actually moving away from services. And as he rightly mentions, criminalization still remains one of the key barriers to us reducing, prevalence rates, as well as actually us preventing the spread of HIV, because people are still criminalized for behavior. People are still criminalized at the workplace. It really does not help the situation at all when you do know that when you go to work, you are going to be tested, and if so, you may lose your job. They create a lot of barriers, and this is what we should remove. UNAIDS themselves actually push for this. A recent Law Commission report on HIV and the law came out at the International AIDS Conference in July, and that report clearly gives evidence that shows that by us removing punitive laws, we will see a reduction in stigma and discrimination, and this, in effect, will see more people coming to test, and of course, prevention will be a reality.
Jiewei in Hong Kong, we've heard Lynette there talking about the stigma of HIV in Africa. What about the stigma of HIV in Asia, and particularly China? Because we've heard repeated reports of patients with HIV being turned away from hospitals in China.
Yeah, we have to face the reality in the report I read, actually, indeed, in some locations, such kind of incident occurs. But in general, if we look at the true situation in a different area heavily affected, for example, the most heavily affected province called Yunnan province in China, actually that's the first province where the epidemic starts. And because of the historical reason, this is a province, there's more resources being secured. At the same time, more training being provided to the local doctors and also the professionals. So if you look at the treatment situation in such kind of setting, the stigma related to the patient, just like you mentioned, some of the patients being turned away in Yunnan actually is not a major issue because they already established AIDS care hospital, primarily designed for treating HIV patients. So once patients being referred to such kind of setting, very good services can be provided. But if you look at the other areas where the HIV is before it's not a major problem, now with the increased incidence or prevalence recently, certainly there's more patients showed up. So for example, we recently did a study in another province which is considered a low prevalent province. That in that setting, actually there's no many well-trained infectious disease doctors can provide services for AIDS patients.
Okay,
so
Jiewei, if I could stop you there.
Yeah.
All of these programs, they cost money. I've seen a figure of 16.8 billion last year the world spent on fighting HIV AIDS in poor countries. The US Secretary of State has unveiled an ambitious blueprint on how to realise the dream of an AIDS-free generation by 2015.
We can reach a point where virtually no children are born with the virus, and as these children become teenagers and adults, they are at a far lower risk of becoming infected than they are today.
Bernard, we've heard Hillary Clinton there. America, the US, spends more money than any other nation on this, but other nations don't seem to be doing their bit, do they? The figures I've got here, per capita spending by Germany, a third of what the US spends. Japan, less than a 20th. It's not good enough, is it?
Well, of course, we are worried that the resources are not enough that we have right now. As you mentioned, we have about $16.8 billion available for the fight against AIDS in the last year. It is important to note that more than half of that actually was generated by the poor countries, developing countries themselves. Clearly, we need more money. Clearly, we need more engagement of those donors who are maybe living a little bit underneath the level that they could contribute, and we are working very hard with them to make sure that we can increase those resources. But we also have to make sure that the money is used in the best possible ways, and we are working together, in particular with African leaders right now, to really launch what we called a program of shared responsibility, where all partners, domestic resources, government, civil society, but also the donors really step up together to the plate to generate the resources that we need, spend them most effectively, and really by doing so be a model for health and development and bringing an end to AIDS.
Well, we heard Bernard say it there. We heard Hillary Clinton say it, Lynette, an AIDS-free generation. Are you optimistic that that can be achieved soon?
Yes and no, but I do definitely agree with Bernard that, it is up to our governments in Africa to actually step up to the plate. A lot of regional civil society organizations have actually formed an Africa Resource Mobilization movement where we're actually speaking to our governments and putting pressure on them to not only speak to the health cause and say that put 15% towards health, but to push for more health system strengthening. Because we think that, a holistic approach to this is what we do require in order for us to see an HIV-free generation.
Okay, Bernard, I want to ask Bernard a last question on that, if I can, Bernard. Your slogan is zero infections, zero deaths, zero discrimination. When do you think this can be achieved? A brief answer, please.
I'm convinced that we can achieve this for the generations, maybe not of my daughter, but of her children. And I'm a proud grandfather, and my dream is that they will see a generation without AIDS.
Thank you, Bernard, and thanks to all our guests. In Geneva, Bernard Schwartzländer, Lynette Mabote in Johannesburg, and in Hong Kong, Jiwei Chen. And thanks to you for watching. We want to know what you thought of the discussion, and we'd like your ideas for future subjects for the show. Send us your comments, suggestions, even your complaints by email to insidestory@aljazeera.net. I'll see you again very soon. Bye-bye for now.